To our presentation today. It's going to go about 25 minutes, so you can maybe enjoy some of the conversation that we've got with our partners here at Nice Healthcare today. So our goals for today are really, the framing of this is Nice is the new front door to winning benefit strategy. I remember the very first time after I got married, my wife and I are living in Southside Chicago. We buy a home that's got 2,000 homes in this new subdivision, and there's one of 3 floor plans, there's one of 3 elevations, and there's one of 3 colors. So you can imagine what that neighborhood looked like, right? Very, very similar. So a couple years in, she says, "Hey, I'm really getting tired of the house. Maybe we should look at getting another one." I said, "Well, how about we start by doing something to upgrade it?" So our realtor at the time says, "Why don't you guys paint your front door?" I'll never forget it. So we went to Home Depot, bought a brand new can of paint, spent a couple hours, and at the end of about 3 hours, we were able to put a whole new front door on our same house. And we looked back and said, "Man, that looks great. It really is an amazing add-on." So for just a few hours of time and about $40, we felt better coming into the home. It had better curb appeal. When we pulled up to the driveway, we looked at the front door and the color. And when we opened the door to have guests come in, it just felt great. So we're going to talk about how Nice is and can be the new front door to a winning benefit strategy today. We'll talk a little bit about our Nice partners and our expansion. Nice has expanded in a lot of states and continues to grow. Joining me today is Drew Callistad, who's co-founder and my business partner at Agility, who's going to dig a little deeper into the value proposition of Nice Healthcare. Drew spent the better part of 14 years understanding DPC, the model, selling DPC in different parts of the country, and so brings a really unique perspective as to the value prop for Nice. Also joining us today is Jory from Nice Healthcare. He's a part of the growth team and an exceptional asset to our broker partners because of his experience designing and building health plans, working with unbundled TPAs, and really has an interesting perspective on how to build the winning strategy financially for your clients. Lastly, we'll talk a little bit about some resources that we've created to help you as you get ready for fourth quarter. So that's the agenda for today. We're excited you're here. We're going to jump in and hopefully you're going to end up with some really cool tools and a little spring in your step as you go out to talk to clients and customers in these next few months. So for those on the call in Colorado, these are our current preferred broker partners. It's changed a little bit over time, but our commitment has been to maintain a small cohort of really intelligent, forward-thinking broker partners and use that as our distribution partner to grow our footprint with Nice Healthcare. In Arizona, these are our current broker partners in that market. And I know we've got a few of those on the call today as well. Excuse me. So by numbers, Nice started 5 years ago now and has grown to over 90,000. That number just keeps growing. There's about 500 clients now that are on Nice Healthcare. And from Agility, we're very pleased because I think the contribution that the Agility partners has made to that is maybe about 1/3 of that total business. So you and your teams and your companies have been a great partner. We look forward to having your success in the next few months going forward. But a little bit about Nice Healthcare and their advancement. For those of you who are interested in leveraging carriers, there are several carriers that have jumped in and said, yes, we're going to support this. And so please leverage your carrier partnerships. A little bit about Nice Healthcare. The gentleman in the middle is the co-founder and CEO Thompson. To his right is Allison Santos, and to the left is Genevieve. Nice is an incredible company. If you're on Nice Healthcare, like the team at Agility, and many of you I know are on Nice Healthcare as our broker partners, it's an exceptional value. What's really interesting, if there were more CEOs who thought and acted and built products like Nice Healthcare, the world would be a much better place. So the point of this slide is that Nice is growing. They're getting outside interest of investors to continue to validate their model and invest in their growth. And so you're here at a good time. We feel like we're part of a very special opportunity, and we hope you feel the same. So a little bit about the states. Those of you who are in Arizona and Colorado and Nebraska, you'll know that, there's virtual and in-person in those states. Listed on the left are those states that NICE currently operates. 12 states, 24 service areas. And then in the virtual care, there's 12 states where if you're in Colorado, for an example, and you've got clients who are in Durango, while it's not a in-service, full service market, they can accommodate members in the state with a virtual option. Last thing on this slide, I just want to point out is NICE continues to grow their footprint. In 2023, they're certainly going to be looking at additional states to go into. So please continue to look for NICE Healthcare for those companies who are domiciled in these states on the left, but also who may have employee populations outside of these states, because it continues to change and NICE continues to grow. So where I'm at today is I've introduced you to this idea of NICE being a new front door to your health plan. Much like I felt when I put a brand new door or a new coat of paint on an existing door, we feel like NICE can be an exceptional differentiator for employers, because much like me living in a subdivision of 2,400 homes with very familiar facades, that's the way the healthcare landscape looks like today. Employers have deductible copays, coinsurance with the major carriers. It all looks the same. Imagine if you offered something that was an entirely different value prop, one that says, yes, I want to join this employer. This is a differentiator for employers. It's free and convenient for members. And so just an incredible value. So with that, I'm going to turn it over to Drew Callistad. Drew, if you wouldn't mind, please share your perspective on NICE Healthcare and some of the services they provide.
Excellent. And can you go back just one slide there, please? Boom. Yes, thank you. So welcome everybody, and thank you, Ken. Great runway there. So what is NICE? That's what we said 3 years ago before we met them. And I just want to say that it's the world that I came from was a lot of on-site and near-site clinics and direct primary care. And what people were solving for was affordable, independent primary care. And when we learned about NICE and we met them and their expansion desires, if you look here on this slide, what is NICE? It threads the needle. It's on-demand, in-home, and virtual care. So you start with virtual, and when you need to be seen or you want to be seen by a provider, they come to your house. All right. And it feels like something that would have come out of COVID, but the truth is this is where NICE was doing this before COVID. Boy, was it a good thing when it came along. Affordably priced. We're going to share today the pricing at $1,123 will be going to $39. It is $36 today. We'll talk about that in a moment. Easily accessible. It's on your phone. What does everybody want to do and where do they want things to happen? And they want to happen fast is on their phone, and uniquely positioned to keep patients on track. We're going to talk about how NICE helps navigate healthcare beyond NICE Healthcare when you need it. So Ken's point, NICE is an amazing front door to a health plan. We tell people, our clients, our broker partners, and their clients, ask your employees to use NICE first and then use your health plan when you need to. That's what's meant by using NICE as the front door. Next slide, please. What's covered within NICE? It's extremely broad. So unlimited primary care, wellness, acute, chronic care, all of the pieces for primary care. Physical therapy is virtual, was added a little over a year ago, but virtual physical therapy, virtual mental health, and how important those two have become here in the recent couple of years. And then a 500 plus formulary prescription plan. That's all included with NICE in the price. The middle two circles on the bottom, over 35 lab tests, and then imaging, x-rays, and EKGs also covered. They do x-rays in your house, believe it or not. They send a team out that has a mobile x-ray unit. So those things all happen at your home with NICE. You don't have to go anywhere. On the left corner and right corner at the bottom, NICE does help with specialist referrals when you need to be seen either in NICE, integrated physical therapy and mental health, or outside of NICE. And then they coordinate with you, your members, and their health plan to make sure that they get to a provider when we need to be on NICE, and to make sure the medical records get there seamlessly and easily. So NICE, that's a big gulp slide. That is the money slide that says how much value NICE is packed in. Next slide, please. This is the pricing slide for 1/1/23. So Ken and I have mentioned we've been working with NICE for 3+ years, and we started here at $36 and now it's going to $39. So a $3 increase. And frankly, they just added the 550 prescriptions, up from about 30 or 40. They added the behavioral health, they added the physical therapy, and there's more coming 1/1/23, which includes folks over age 65, which today are not eligible, will be. So the price increase does not reflect inflation. It reflects an additional value within NICE Healthcare. The $10 is if you have an employee that's not in a service area, say you're 100 people in Denver and 10 in Grand Junction, the 10 in Grand Junction are $10 and they're virtual only. If you have 10 in Grand Junction and they want NICE, but there's no on the ground team, then they pay $28. So full service is $39, 10 is virtual, or $28, depending on how it's used. And so there's a couple of different ways. We'll come back to the pricing with Q&A at the back end. Go ahead, Ken. So how it works. Again, this is the front door to healthcare. When you need care, and the world today wants care immediately, 99% same-day visits. Same-day referrals when you need to get into musculoskeletal, you need physical therapy, mental health, pharmacy, primary care. It's almost always same day. No need to think, simply reach for your phone, hit your app, connect with NICE. You're connected within 4 minutes, often within 1 minute with NICE, and off you go and you're on your way to your care. Next slide. So this is how it starts. Pick up the phone. They do want to engage with you, engage with them first, establish care. So you're not calling them sick, you can, but you want to establish care first. Patient history, all the things you would go through with a normal, really not normal, but status quo provider visit, but it happens virtually. And then you get to your chat or video visit, or they come to your home. Next slide. When they come to your home, physical exams, rapid tests, blood draws, lab draws, imaging, all this can happen when they need to see you. When these tests need to be done, they come to your home. And about 30% of the visits result in an in-home visit. So 2/3 stay virtual, 1/3 are in-home. Next slide. NICE physical therapy. So I use this myself. I wanted to make sure I knew how this all works. So last winter, after my shoulder was not good from some snow shoveling and I had a bad shoulder, I said, let's give it a try. Got on with the therapist. We had a visit. He interviewed me within 10 minutes. We went down and did a video share of my home gym equipment. So we knew what we were working with. Gave me a regimen, emailed it to me. We checked in weekly for 4 weeks. Shoulder was back in business. I never had to leave my house, didn't pay a dime. It's amazing what a lagging and nagging injury did and how quickly we took care of it with NICE Healthcare. Next slide. Mental health. This is, you look at the dots in the middle. These are the things that everybody in America is going through right now. You can't walk down the street without running into somebody that's got a lot on their plate. And NICE mental health therapy is the front door to behavioral therapy. And all of these issues you can tag into your NICE clinician, get access to mental health. There is no wait at NICE Healthcare for this. Virtually every other office in the ecosystem for mental health and virtual and anywhere is a line out the door for, unfortunately. And at NICE Healthcare, they have strong capacity. They're willing and ready to serve everyone. So this is, again, a virtual program, very available, very, very valuable in today's world. Next slide. The pharmacy details over 550 medications, representing statistically 50 to 60% of all prescriptions, will be no cost to members. we find when we assess groups coming in, it actually represents 70 to 90% of the meds their employees are taking that would immediately become free to the member. NICE arranges for the prescription to be sent to their home or a pharmacy nearby, everyone for the most part except Walgreens. And next slide. And then extended hours. It's important that NICE is available when people need it. So virtual visits in the top half there, Monday through Friday, 7 a.m. to 6 p.m. Mountain Time, so early and a little bit late after work. And then Saturday and Sunday morning hours as well. And then in-home visits, 9 to 5, Monday through Friday. Times shown are Mountain Time because that's who's on the call.
Mm-hmm. Drew, that's awesome. Drew, that's awesome. Thank you. So for those that are, I know a lot of you on the call have sold more than a few groups with NICE. So just know that the rates are going to go up starting 1/1 for new business. They won't change until the group renews. So if you had a 7/1 group that came on 7/1/23, the rates will change. 22, sorry, thank you. They would change then next year, July 2023. Drew, thank you so much for that great reminder. I'm glad that your shoulder's better. It helps me out as well.
Thank you, NICE.
Thank you, NICE. Over to Jory. For those who have not met Jory, Jory has been in the industry for a long time, and he's joined NICE several months ago, and he's been an incredible partner. He works with many of the brokers that'll be on the Agility team regionally and nationally. So Jory, over to you. Would love to hear more about how you have seen companies succeed in funding and some of the strategies on how to integrate NICE.
Sure, absolutely. Yeah, why don't you advance the slide here and we'll kick right into it. Perfect. So I'm going to go over some of the high-level details of why employers are really excited about this programming. And one of the big elements, and Drew did a great job giving a summary of all of the services incorporated into our program offering, but the fact that employees can get access to roughly 70% of everyday healthcare needs for free brings a huge element of flair into this program offering and really engages the patient population to keep using our service when they need healthcare, right? And that scope of service really drives our utilization much higher than compared to virtual only platforms out there. And then something that's easily forgotten in the flurry of kind of fourth quarter is that our program covers anyone who legally lives at the same address as that employee. So the coverage is covering roommates, if your sister lives with you, if you're a multi-generational family. It's not tied to the dependent classification of the health plan, right? And that's really cool for a younger population who maybe has roommates or things along those lines. Ken, why don't you go to the next slide? And this is a really great slide to kind of put a focus on where our savings can be driven from. And you can look at this with a lens of the employer, especially a self-funded employer, or taking it from a lens of the patient. But all of these columns here with pricing is the typical cost that you'd see for a primary care visit, RX, urgent care, specialty care, through a health plan, right? When a service happens at NICE Healthcare, that means there's not a respective claim on your health insurance plan, right? So depending on where that member is at within their out-of-pocket spend or what their copay is, a portion of this could be employee savings and a portion of it could be employer savings. Our typical employer savings across our block of business is $453 per employee annually, okay? The savings to the employee can be in the thousands. Just think about avoiding an emergency room visit or finding out that your script that possibly costs you hundreds of dollars a month on a higher deductible healthcare plans covered underneath our list of drugs, which commonly happens. Ken, I'll let you move on to our next slide here. Keeping in mind that last slide, it's really important to look at your client and the strategy for making possible broader changes to their fully insured plan or their self-insured plan to optimize the performance of nice healthcare. I think it was the Ken who had gone through the slides talking about if you're looking at a fully insured group, we've got 12 carriers around the country who are giving us premium credits. Some are also doing a subsidy of the cost of nice healthcare. Take advantage of that programming. Look at maybe making a change from a plan standpoint to increase copays on primary care visits, or on your RX copay structures. Trying to drive that fully insured premium down slightly, while bringing a very impressive new benefit to employees that gives them first dollar coverage on 70% of what they need. All of these elements are ringing true in the self-funded world even more, right? These employers have the ability to achieve that savings any given month, right? You know, if they're funding claims as they go, if they're self-funded health plan, a claim happening at Nice Healthcare means there's not a claim happening on their health plan, and that's saving them money. And so when we're looking at that, always keep in mind, don't just kind of plug us in. We're going to work great and we're going to gauge employees on any plan. But you can take it one step further and really customize and tweak those copays and deductibles to a control premium as well. Go to the next slide. Our process in terms of getting a quote is pretty easy. Our growth team is allocated by brokerage firm around the country. I think likely for most of the people on this call, I'm your growth team lead. If not, it's likely Paige on our team. But if you get us a census file, including zip codes of the employees on the medical plan that you're quoting, and what effective date and what effective date that you want, we can turn a quote around pretty quickly. Typically in between 1 and 3 days is our turnaround time on that. We'll get to it as quickly as we can. And the growth team will get you a summary breaking out who's in the full service areas, who's in the virtual only service areas, as well as a price. We're going to talk about that with you. And then we're always happy to jump on a call and do a presentation similar to this to walk that client through our product offering. In terms of getting the group up and running, we have a very simple intake form that takes about 3 minutes for our broker partners to fill out, and that kicks off the implementation. Our engagement specialists are assigned, and that kicks off that onboarding. Ken, I'll have you move to our next slide here. This is just a quick screenshot of the census analysis and quote that we typically are seeing as output. This is looking at every zip code on that employee population and allocating who's in full service area and who's in the virtual only at a reduced price point. And then we give the total numbers there. 95% of the time, this is enough to bring it to the group, show them, get them comfortable with it, and potentially get the group sold. If you have a group who needs a formal proposal and wants this information put into the 10-page document that looks even more pretty and explains all of our kind of program offering in more detail, we're happy to do that as well. Ken, why don't you hit to the next one? And this is an overview of our implementation timeline. Our groups do have launch dates of the first of the month, and we are confirm on a 30-day installation timeline. Of course, we could do this faster, and we have done it faster, but we've found in our 5 years of existence, if we can give the employer 30 days, it's much more of an enjoyable experience for that employer, and they're more effective at taking it step by step and getting those employees engaged and understanding what our program offering is. And so keep in mind that 30-day kind of implementation window and the first of the month effective dates. And so, yeah, our next step here is to really focus on a couple of selling tools for you coming into our fourth quarter, in the fourth quarter now. An awesome program is Nice Try. It's a pun, undoubtedly. And this is a way that you can give up to two the contacts in an organization a no-risk 45-day trial of our service. So if you have a head of HR, a CFO, a CEO, encourage them to try our program and go and get a proactive physical and test out our service offerings. Again, 98% of our patients rate our service better than their previous clinic. We believe that if we can give people a try on this, that it's going to close the deals kind of on our end, and hopefully it can help you sell a couple of your prospective groups as well. To our next slide, Ken. And then this is a cool one too. This is early sign-on credit. This could be a really kind of good focus here in the next 40 days or so. Any group who commits to a January 1st effective date and commits prior to November 1st is receiving a 1-month credit on their account. So billing will start in February. And so that's a really great way to bring these groups on, and effectively you're offsetting our price increase in 2023 for that first year by implementing this. And so Ken, I think that's all I've got.
Jory, thank you. That was a great description. We'll turn it over to questions in just a moment, but maybe just to wrap. New things coming in 1/1, a modest price increase to represent the increase in value. 65 and above are now eligible for NICE. Jory did a great job talking about 2 new promotions. Love the idea to pick a few prospects that brokers are not currently the agent on or the broker on, and use that as a way to introduce that program as a value. Because again, not every broker is working with NICE, doesn't have the ability to. So Jory, thank you for that. And Drew, thanks for going through that as well. My last piece is just for those on the call, you guys are great partners. Thank you so much for joining. I'll turn it over to questions in just a moment. Our request of you, if we may please, just look at a couple targeted clients. What are groups that you want to win with? What are groups that you already have that are looking to improve their benefit strategy? Take a short list of companies and let's go after them with your help, please. Last thing, just from the agility side, and hopefully this might work if I can share my screen. Can you see the landing page, gentlemen?
Not yet.
Not yet. Okay.
It was trying.
Okay. We've created a landing page, and I'll email each of you the landing page link, but short videos, all the sales materials, changes in the pricing, the new benefits for 1/1, the promotions, everything is there, easy for you guys to access. If you're in Colorado as well, you'll notice we've paired NICE with a newer health plan that was launched earlier this year called 39 North. So imagine all these benefits with NICE as the front door to a health plan, and a new age health plan around NICE built in as the foundation. It's for 50 or more employees. We've got some upcoming training and some opportunities for you to learn more. But for those that are on the call, I want to now respect your time and see if we can turn it over to you for any questions. Jory and Drew, thanks so much for partnering with me today to walk through this update. Maddie, do we have any questions either in chat or on the call?
I'm not seeing any in chat right now.
Okay.
I will keep you posted.
Thank you.
Ken, the only thing I would maybe add while we're waiting, if any questions do come, is know that they're very close here. 10/1, 11/1, 12/1 effective dates are still the current pricing. And will last, we said this earlier, but will last for a full year before the new pricing kicks in. So that's also another reason to talk to people now. If you have 2 or 3 prospects that you know are with other brokers who are not on the list, if you want to brainstorm with us 5-10 minutes on how to position it, you can go in and bring something the others cannot. So just know that we do that intentionally, and we think it should be a market advantage for you. And hopefully you can go win 3 to 5 new groups using NICE.
Awesome. Thank you for that. Well, unless there's any other questions, we'll let you get back to the rest of your day. Thank you, everyone, for joining today, and have a great rest of your day, and give us a call if we can help in any way. Appreciate you very much, and thank you for your partnership.
Thanks, everybody.
Thanks, everyone.
Bye-bye.